Welcome guys. Now I'm going to teach you the PLAB rectal examination or the digital rectal examination. It is very important. The indications are PR bleeding, constipation, any mass in the rectum or loss of weight, as well as there is very important indication if the patient comes with a lower back pain and loss of bladder and bowel control, which is a Kodak-Koena syndrome. So this is an intimate examination. It is important that you explain the procedure to the patient and get their consent and get a chaperone as well. It is contraindicated in case of the fissure. If the patient has a PLAB rectal pain, do not please perform it. It is very simple. I'm going to show you the requirement of this procedure. The patient should be explained fully. They should be aware what they're going through. Tell them in simple few words that you need the exposure to the private area. The patient should be lying on their side with both thighs closer to their tummy and with both knees bent. You need the exposure to the private area, and during this procedure you will be looking for any abnormality in the private area, and you will be putting the finger in using a jelly. That is important to explain, and also get a chaperone. Make sure the privacy is maintained and the patient remains comfortable. After you explained, get your material. You can see the apron. This is one thing that you need. Then you need a pair of gloves and a jelly. Okay, so without any further ado, I'm gonna start explaining and showing you on the mannequin. So let's begin. So after you put the gloves on, you do not need a sterile glove, just a normal glove is okay. A pair of gloves, fine. Tie your apron behind your back. And assuming that the patient has made the position, patient is lying on their back with the both thighs closer to their tummy, you reach the patient and make sure the privacy is maintained, and you have the chaperone as well. Get the jelly. You need to have a few tissues as well so that you can clean after you've performed the procedure. Perform a formal inspection. Look for any skin tag, any tear, any ulcer, any wound, especially in the sacral region. The patient may have ulcers, the bad sores, and if there's any bleeding, comment on that. If there's any tag, any hemorrhoid, comment on that. Then warn the patient before you insert the finger in. Lubricate your finger properly and put a bit of jelly at the orifice as well. After that, warn the patient that now I'm going to insert the finger, and slide your finger in the groove down. Do not insert the finger straight. After you insert the finger, just anterior to this you can palpate prostate. Move your finger to one side. Try to feel if there's any abnormal growth, any mass, any abnormality that you can feel. Then move the finger to the back side and feel the posterior wall of the rectum. Similarly, continue moving and feel the other lateral wall of the rectum. After you felt that, bring your finger back to the neutral position, the way that you inserted it, and just before you remove the finger, ask the patient to give you squeeze. This is very important, especially if you are performing this for the Kodak-Koena syndrome, because the patient may have loss of anal tone. It is a clinical emergency. So ask the patient to give you a squeeze, then you remove the finger once the patient is relaxed. When the finger is out, look for any bleeding, anything abnormal. You can find any bleeding or melena on your finger, And that's all about it. Clean the patient, cover the patient, and thank the patient. Do not forget to document this examination in the notes. That's all about it.